What's good? Muria Zimbabwe, Mtwakazo Mushe, Zimbabwe Mushe, Kwazwai, Muria Zimbabwe. Welcome to The Connection, a Studio 7's very own youth program that targets tackling anything and everything youth-related. The broadcast you're tuned into right now is LiveTalk The Connection, brought to you by Studio 7, Voice of America, and today, Muria Zimbabwe, is Tuesday, the 20th of October, 2020. Muria Zimbabwe, Mtwakazo Mushe, Zimbabwe Mushe. I'm your host, Michael Hove. First order of business, Muria Zimbabwe, before we delve deeper into our program, Muchirongwa. Unfortunately, Silusi Zitino Urombo, Muria Zimbabwe, due to COVID-19, we're working from home. What this means is, unfortunately, we cannot give you this broadcast live as per usual, and you cannot tune in, you cannot join in to this conversation and call in as per usual. Nonetheless, Muchirongwa sisonke like so. And what this means is, you can still send us your feedback on WhatsApp, on our WhatsApp number, +1 202 465 0318. Dio number ya mukwanisa kututumira maondero yenyu pa WhatsApp +1 202 465 0318. And this broadcast is also going to be available on our 3 Facebook pages soon after our radio broadcast, VOA Shona, VOA NWA, and VOA Studio 7. So for those that are going to be tuning in on our Facebook pages, please feel free to leave your comments in the comment section and we will see your feedback. Tonight on The Connection, Muria Zimbabwe, we continue the conversation on COVID-19, with coronavirus. We speak to young experts about how the global pandemic has impacted Zimbabwean youth. Saka ndio nyaya tichizeya nasi Muchirongwa muri Zimbabwe tichiendera mberi tichitarisa zviri kuitika pasi rose tichitarisa zvakare zviri kuitika muZimbabwe kuti nyika yeZimbabwe iri kukanganiswa sei nechirwere checoronavirus. Tichizeya nyaya nevechidiki nyanzvi munyaya dzeutano. We're also going to be looking at the current state of Zimbabwean education. The government school curriculum entered a week 4. So 4 weeks in Zimbabwe, whereby schools have been opened. However, what this means is students have not received a formal education in 4 weeks due to the fact that kwevarairidzi, ababalisi, the teachers are not in class right now. They're still currently protesting. They're protesting 2 things. Number one, their current salaries. As we speak, teachers in Zimbabwe are receiving an average of at least $45 per month, of which, as highlighted by Melissa Changwanangwana, my guest on the show last week, they're not even receiving it as hard cash in US dollars. They're receiving it in as a direct deposit into their bank accounts, which is coming in local currency, that being bond notes. So for them, they're saying that they want to receive an equivalent of at least $500 US. That is, if they're not receiving a $500 US hard cash. So another thing that they also are protesting is the fact that in the country, they're saying that there is not enough PPE within all these schools. So schools have entered week 4. However, a lot of schools that are under the government sector have not received PPE or do not have enough PPE, especially in the rural areas. So that is not the only revelation that we're looking to focus on. We're also looking to reveal that Zimbabwe has experienced an increased amount of teenage pregnancies under the lockdown period. This is for different reasons, amongst them being something that teachers are going to be touching on. And of course, other women's rights advocates, they're going to be touching on why there's been this sudden spike in teenage pregnancies under the lockdown period. So we look to hear more of that later on. But first up, COVID-19, coronavirus. According to Johns Hopkins University, over 40,480,000 people worldwide have contracted COVID-19. I repeat again, over 40,480,000 people worldwide have contracted coronavirus. Approximately 1,120,000 people have died due to COVID-19 worldwide, and some positivity, Muria Zimbabwe, over 27,740,000 people have recovered worldwide. So the worldwide figures, once again, are as follows: 40,000,000 480,000 people contracted coronavirus to date, and approximately 1,120,000 have died, and some positivity over 27,740,000 worldwide have recovered. Once again, this is a pre-recorded program, so by the time we go on air, if you go to these sites, there's a high possibility that these figures would have changed. However, that is the ballpark figure. According to the most recent tweet in Zimbabwe, the Ministry of Health, Zimbabwe currently has over 8,150 COVID cases, 232 deaths to date, and over 7,683 have recovered from COVID-19. So just to repeat the figures one more time, in Zimbabwe, according to the Ministry of Health, we currently have over 8,150 COVID cases. The death toll currently stands at 232, and the recovery rate is currently 7,683 people have recovered from COVID-19. Now, the latest information released by the Ministry of Health, once again, highlights that the cumulative amounts of tests have not been shown on their latest information release. However, 564 PCR tests were conducted just yesterday alone. 12 cases tested positive, and to date, 7,683 people have recovered from COVID-19. Yesterday, we witnessed a death. One person died due to COVID-19 in Zimbabwe. The country currently has 244 active COVID-19 cases. Now, medical experts also were touching in on this. One thing medical experts are saying is Zimbabwe, do not take your foot off the gas pedal. And Zimbabwe, so far, we've done so well in terms of managing coronavirus cases. They're urging Zimbabweans to continue taking the same strides in terms of preventing the spread of COVID-19 in Zimbabwe. So they're urging you to continue wearing your mask. They're urging you to continue washing your hands as regular as possible. And they're urging you, make sure that you don't meet in your large numbers. Let's head over to a bite of that where we have courtesy of Professor Solwayo, who is the director of Mbilo Hospital, who touches on the possibility of Zimbabwe experiencing a second wave. And of course, he gives advice to Zimbabweans to ensure that we don't continue spreading COVID-19. Let's hear more from Professor Solwayo.
Xwayisa ligqoka ama-mask nokuthi ligeze izandla lokuthi lingaxokozeli lifuqana limelele izinto lapho elithenga khona. Liyaxwayisa kakhulu umkhuhlane lo kukhanya subuya okwesibili. Kwezinye indawo nxa ubuya kwesibili kukhanya ukuthi uyabe usulamandla. Siyaxwayisa kakhulu bantu bakithi lilandele khonokho elakutshelwa nguhulumende. Ama-mask aqakatheke kakhulu. Sibona abaningi liwagqoka kodwa lichiya amakhala phandle. Lokhu kuyingozi embi kakhulu. Siyalincenga abantu bakithi. Umkhuhlane lo uyayenelisa ukubulala abantu abaningi nxa singawunanzelelanga. Yikho libona lokho esilixwayisa khonapha emaredweni.
Professor Solwayo giving his feedback to Zimbabweans. Hanzi aiwa muri Zimbabwe, please musakanganwe endrai mberi muchigeza maoko as regularly possible as you can. Hanzi mukana musina henu nyaya yekubuda neuwandu wenyu. Hanzi please musanosangana neuwandu wenyu. Please endrai mberi muchipfeka mamask pamunobuda. That was Professor Solwayo. Now, if you're also wondering, what has the experience been like for abantu abasakhulayo who have contracted COVID-19, we also received a bite courtesy of Thabiso Kumete. Thabiso Kumete is one of the young Zimbabweans who has contracted coronavirus, and he explains as to what was his experience like. According to Thabiso, he says it wasn't even hectic. He didn't even realize he had COVID-19 until he got tested. So let's hear more from Thabiso Kumete as he basically breaks down his ordeal of what it was like contracting coronavirus and what symptoms he was showing.
Yeah, corona satholakala silayo sebele. Engakubonayo ukuthi mina kuya ngomzimba womuntu ukuthi umzimba yabe uqina kunjani ngesikhathi soneso etholakala elayo i-corona. Mina ngatholakala ngisaye ngitshengisela any ama symptoms emzimbeni ngaphandle kokuthi ngangichawa likhanda kwesinye isikhathi. Kodwa ke ikhanda lakhona ongeke washo lalo ngoba kwakuyikhanda lento elejayelekileyo nje.
So, Muria Zimbabwe, you were hearing there from Thabiso Kumete Ngempela, who was explaining his ordeal ebanjwa ngalo mkhuhlane we-COVID-19, echasisa ngempela ukuthi yena, he just felt a slight headache. It wasn't even anything drastic, and that's what made him realize that maybe I should get tested. He got tested for coronavirus, and he was explaining some of the symptoms that he had to go through. So those are some of the symptoms of people that have actually contracted coronavirus and what has happened. But now, experts are also highlighting another issue in Zimbabwe, which is the rural areas. Now, time and time again, we have had medical experts come onto this program, and they were saying that emaphandleni khanya ngani kuloduba kumamisha uko kunenge kunetika nyaya pamsoro pekuti mamiriro akaita upfumi hwenyika make it very difficult for vanhu vanogara kumamisha to receive the adequate necessary preventative clothing, such as masks, the PPE, necessary PPE, to ensure that they don't, partake in the spreading against coronavirus. We reached out to Nkosikhona Dividi of Community Podium TV, who was recently in Cholocho and Lupane, and Nkosikhona basically breaks down his deal of what he saw in these rural areas. And he also touches on what exactly they're experiencing when they talk about coronavirus, the water issues, and so much more. Let's hear more from Nkosikhona Dividi.
In a day or two in Cholocho and Lupane, we noticed something that is different about the remote areas or remote communities when it comes to COVID-19. Mm-hmm. Like when you're talking about the Cholocho Business Center, it's more. There was a lot of activity, mm-hmm. and you find that there was less of PEs. Mm-hmm. Literally every shop you would go into, you are likely going to be the only one wearing a mask because probably you are coming from the city. Mm-hmm. And so, well, in our interactions with the local authority representatives, your councillors, they will be saying, no, we just do the social distancing and we share information to people to say they shouldn't greet each other in public places, they should keep their distance, and you find that there's less activity that gathers people in the rural communities. Mostly it's people within their homesteads and also maybe going to fetch water, of which people ideally, the councillor was saying people will respond better to those instructions. We think this thing is a killer disease. Let's guard ourselves. It's easier for them. So you find that PEs are expensive. Most of the people in the homesteads can't afford at all. They could try maybe the clothes, but they are saying we'll try to do the social distancing. To the center, there was no was actually wearing a mask that I saw. It was just the issues of around social. So I was ready to see that I am just entering this shop without having someone by the door sanitizing. So these are the issues around, probably in my view, around capacitation, economies of scale, where people can't afford to be sanitizing, like local businesses in Cholocho can't afford to be sanitizing all the time. And also without support, really external support, many businesses can't afford, because speaking to which, the days when we were there was no electricity. So they were hustling around, making sure that you don't get loose stuff because there's no electricity. Say you are running generator 5 minutes, every 10 minutes you are switching it off and on and things like that. So you find that the economy is there. It's completely different. The lifestyle there is completely different. Hence, when we are fighting COVID-19, we should consider how we actually assist and capacitate these local communities with the required PEs. That would be handy.
Now, let's delve into the healthcare sector within the areas. We see in big cities like Harare, Bulawayo, some hospitals and clinics actually got to a stage and point whereby they shut down because of lack of PPE, being one of the generating and pushing factors behind it. Which makes me wonder, Wuti, Emma areas, what is it? So what are the local hospitals and clinics doing there?
Actually, we had an interaction with a guy who had a health challenge right there in Cholocho. So the local clinics don't have much. They can't assist much, like on the basics, really. So you have to be transferred to Cholocho Hospital, that is in the center of Cholocho, but you find that the issues are the same. They'll still refer people to Mpilo Hospital, of which Mpilo Hospital is where we are, and we know that it's incapacitated already. So you find that in that chain, there is serious challenges. The challenges that we actually face in the city are worse in the remote areas, because all those people with critical conditions are referred into the cities, and the cities are already incapacitated. So it's a crisis that we have. And when you are talking about in the context of COVID-19, I'm sure, because some of the residents that we spoke to were speaking around issues, we'll drink those herbal,
Right.
should you catch any flu or schaka or bani bani, that's how they feel they can sustain this whole pandemic.
Which then begs the question around the information. Are they receiving enough information about COVID-19?
Well, they are not receiving enough information about COVID-19. Many would refer to radio and say, we hear about it in the radio, we read about it on WhatsApp, but there's nothing that probably has been done at a local level, particularly in Cholocho, to then say, this is what we're doing, and this is what council is doing, this is what headmen are doing, and things like that. So you find that there could be information gaps there, but however, maybe they have a way of handling the COVID-19 pandemic, as it were, because they will tell you about, we've got this slataless and this herb, so
Right.
we shouldn't worry ourselves. Should you need some, you can have again at the town.
Right. Which then leads me to my next point. I see you touched on the comparison early on between what's happening in the big cities and in the rural areas. We know in big cities, for example, one big issue is the water shortages. Both Harare, Bulawayo, a lot of major cities in Zimbabwe right now are facing water shortages, which can only make me wonder once again, what are people in the rural areas doing? Are they facing the same challenges?
Yes, they are facing the same challenges. I'll speak to one ward in Lubane that we visited. That is Ward 26. Wow, there is no water there. This whole climate change thing, and the water sources are very limited. A whole ward will have like 2 boreholes. So which means you have to walk like over 8 kilometers to just get water. So you find that when we are now talking about washing hands, when we are now talking about COVID-19 awareness, some of these things get to be really irrelevant to them, because accessing just water to drink is a milestone. It's an achievement to say, I've gone and I've got a 20-liter bucket, I'm back. It's like we've achieved something. So you find that in communities, it's very dire. We talk about Bulawayo, where we usually get water from our taps, but in the communities it's actually worse, because the wells that they used to have are drying up, so they need to dig deeper. You find that in that ward, the councillor was actually highlighting that they have to go up to 100 meters to get water. Usually they would get it at 35. So those wells dry up. So you need to go deeper for you to access water. So it's a crisis that we have. And looking into the cities, it's the same issues. Right now, COVID-19, I'm not sure whether I can call it second wave, but yesterday, Bulawayo, out of the 37 COVID positive cases, 20 were in Bulawayo. So I'm not so sure whether we are sliding back into that issue, or because water is not there. Some of us get it once, and we are so, because some have gone for quite more longer periods without water. And now the question is, if we say let's wash our hands, how? The question is how? Where do we get the water? And what can be done to assist in the where people get water, where people queue to get water, things like that.
Now, to pull you back to the conversation on PPE, I was reading I follow Community Podium TV a lot, and I have been reading some of the articles that you guys have highlighted and focused on the things that are being done in Cholocho, for example, with regards to PPE. Are there any initiatives that are being done that are helping the communities with regards to receiving PPE, be it water donations and so forth?
Yes, in communities you find that there are people who donate mostly PPEs. Some actually recommend the material clothes. So there was a well-wisher who actually donated to a school because the school didn't have PPEs like completely, and they were already having Form 4s that were coming in preparation for their examinations by December. So you find that parents can't really contribute in those remote areas to say we need money per student to pay for PEEs, but well-wishers then come in, chip in and say, okay, we can at least give you this much of sanitizers, this much of PEs, just to cater for the few that are in the school, that is the exam writing classes. But you find that according to the government schedule, by mid-November, everyone should be back at school. But the question is, are schools ready for that? In the cities, well, the schools just push the cost to the parents. But how about in the remote areas? What are we going to do?
Which then leads me to that question, of course, with regards to the schools. We see right now a lot of teachers, especially those that work in the rural areas that are under the Amalgamated Rural Teachers Union of Zimbabwe, are saying they're not going to school. Why? Because of the low salaries, but also the fact that they say that the schools are not ready to be opened because of lack of PPE. When you were in Cholocho and you went to some of these schools, what did you see?
Most of the schools had at least two people, usually the headmaster and the senior teacher only. That is from the three schools that we saw. Those are the only people that were there. The teachers were not there. So however, the school students still come to school because it's difficult. After speaking to some of the students, they will tell you it's not possible for me to sit at home and say there are no teachers. Parents will say, no, schools have opened, you have overstayed at home, go to school, And then you find in this school in Cholocho, that is Ward 12, the kids were meandering around with nothing to do, with two people at school, and they can't control all of them. So you find that we can say schools are open, and we can say examining people that are sitting for exams this year are actually in class preparing for those. But the case on the ground is there's nothing of that happening. So why risk and say kids go to school without the necessary PEs, without the assistance that they would require from their teachers? So that's the issue now. And parents listen to what is being said on the radio and tell the kids to go to school, and the teachers have made it clear that they are not going to school, citing some of these issues around PEs in light of COVID-19. So it's a case where we might need stakeholders to sit down and see what is practical and how it can be done, because PEs in rural schools are not there. It's only well-wishers that chip in, like one who did in Ward 8 in Cholocho, and supplied the PEs to the school for a certain period and for a specific number of students. So you find that without that kind of assistance, it's a risk for us to open the schools in this scenario.
And even in the case that you're citing, the PPE being given, was that enough for the whole school, or was it just for a specific number?
It was just for a specific number. Actually, not more than 50, I think. Not more than 50, and the sanitizers were not so much, probably just over 5 liters, and that is just sustainable for a short period of time. And what comes after that, no one knows. The head of the institution doesn't know what to do, and the students are all there, and they know there's COVID-19, there's need for sanitizing, and there's need for masks. Obviously, some didn't get the masks because they were so few. So that's the crisis we have.
Asithintene udaba lolu ngolumi lukamama Mnumzana David. Usanda ukutshela ukuthi uke wafika ngale echolocho njalo ngaselupane. Awusitshela ukuthi abantu izakhamizi zalezo indawo bathini ngokumemetheka komkhuhlane we-COVID-19 okwenzakalayo elizweni.
Abahlali bemaphandleni kakhulu lapha echolocho laselupane kade sisebenzela khona coronavirus lesihlobo esisegoli ngale i-coronavirus so yinto abasebeyizwile kodwa uhlupho lukhona ukuthi khona nxa kuthiwa akugqokwa ama-mask nxa kuthiwa emavinkilini lapha akusanithayizwe abavinkili akhona hala imali zokuthi bekwanisa ukuthi besanithayiza njengalokho okwenziwa emadorobheni uzathola ukuthi nxa uhamba njengase-echolocho business center laphana kukalutshwana ukuthi ungene amashophu engawangenayo anzaye ngibone kusanithayizwa ngoba osomabhizinisi bakhona babekhuluma ukuthi vele thina silezi nkinga zethu amagetsi ahamba 2 weeks kwesinye isikhathi 1 week so sebezama ukuthi bebone ukuthi amafriji ayasebenza lani so you find ukuthi indawo leyana ilama-challenges njalo nxa sesibuya ku-coronavirus kule cost ehamba lakhona ukuthi sokufanele ukuthi kube lama-PEs sesithola ukuthi lasemaklinikhi ama-PEs akula uthola ukuthi izakhamizi azilama-PEs sebephonga ukuvala ngakho abalakho nxa besiza ezindaweni ezinjengabodolobheni so khonkana kungani ukulwisa kwethu umkhuhlane lo ngani akusoze kuncede kakhulu especially ezindaweni ezinjengasemaphandleni ngoba akula engathi ama-resources achaneliweyo ukuthi ancedise indawo lezi abantu besiliswe kulo mkhuhlane we-COVID-19.
Isikhathi sesehliwe nguMangoyi David sigqiba phela ingxoxo yethu siye swaphela ingcwethi kwezempilakahle abagoqela udokotela Solwa Ngwenya besithi hayi umkhuhlane lo khanya ngani ngesingisi sesingathi sekule second wave usebuyile okwesibili sikhangela okwenziwa ngabatsha ulawo yinamazi okuphosela kulabontanga okumayelana nokuvikela ukumemetheka kwalomkhuhlane.
Uprofessor Solwayo sibili bengingaxoxa laye kule inyanga ezidlulile khuluma ukuthi hayi man into leyo akumelanga ukuthi ngani siyayekelela kumbe siyayekethisa ingani ayisekho sesingani sesiphila impilo zethu kodwa imessage yami kubantu abatsha ukuthi khona ukugida sizagida next time but khathesi let's stay safe simake sure ukuthi i-lockdown liyana esike saba la yadi buhlungu kade songani sokuvuleka sokumele abantu beke sike sikholise kodwa ngithi bantu abatsha hayi asizameni ukuthi sike sime kancane ngoba ubhubhane loncane kuchaya i-second wave baningi abantu abafileyo ku-first wave bantu ukuthi ku-second wave lathi sibalwe khona lapho kulalokho esingakwenza lathi ukuthi sizivikele njengabantu abatsha asizameni sibe ukuthi siqinisele sincedisane i-messages sesizwile abanye sebeyizwe kakhulu abasafunda ukuyizwa but umkhuhlane we-COVID-19 ukusakhona asizivikeleni.
Muri eZimbabwe mazinzwira ka from umnumzana uNkosikhona David sithanda ukubonga uNkosikhona David ngokungena kuhlelo lwethu lwabasakhulayo. Muri eZimbabwe manga muchinzwa ka kubva kuna vaNkosikhona David phephandaba community podium TV kubulawayo ko vaNkosikhona David tangachitaura nawo vanga vari kubulawayo ko vanga vari kucholocho vanga vari kucholocho nekulupane vakambosvike kumaruwa uko vanga vachizeya nyaya dzakasiyana siyana vachitsanangura kuti zvii zvavari kusangana nazvo kumamisha tikuonaka kuti tsamba dzatotanga kupinda apo paFacebook baba Hove aiwa musaigwa tinotenda zvikuru nekupinda Muchirongwa vari kukomenta kapane zvambotaurwawo naNkosikhona David vachiti hanzi kumamisha uko kune mishonga yakasiyana siyana iri kushandiswa nevanhu baba Hove vari kuti hanzi kune that plant inonzi zumbane people are using it. Totoiti rinoshanda mukoma. Aiwa tinotenda nemaondero enyu, tinofara kunzwa kuti vanhu vari kutora matanho akasiyana siyana. Tichaunzawo dzimwe nyanzvi totokurukura nezvenyaya iyoyo kuti kune vanhu vari kushandisa maailments akasiyana siyana. Tinombonzwawo vamwe vanhu vachibata nyaya dzeginger tea vachiti hanzi aiwa kuno kuti tinombonwa ginger tea tinoona kuti inoshanda. Saka tichaunza nyanzvi munyaya dzeutano, tobata nyaya iyoyo pamwe tichazviunzawo tobata. Saka teerai, enderai mberi muri muchiuya pano pachirongwa chedu chevechidiki wohlelo The Connection muineni Mike Hove. Kodwa sithanda ukubonga umnumzana Nkosikona David ngokungena kuhlelo.
In Lupane and Cholocho, a lot of households have been facing food insecurities due to human and wildlife conflicts and also climate change. In order to find out how these communities have been surviving, do check out the 2 documentaries by Community Podium. My name is Mzo7 aka Mr. Gagagogo.
Shout out to Mr. Gagakuku. Ngalo wake ne message yatabva kupiwa namzo7. You heard that that's some of the work that Community Podium TV is going to be doing. So make sure you pay attention. They're on our Facebook, YouTube, Instagram, and Twitter at Community Podium. So make sure you check them out. Tichiri Zimbabwe also in the same discussion of COVID-19. There's some Zimbabweans here in the diaspora, Munomu, Mudunure, Washington, D.C., who are currently working together to fundraise and raise funds to help the healthcare sector for Zimbabwe. Takabata umwao, pasi, vari pasi, Muchirongwa, pesangano, Nyasha Africa. So this organization is called Nyasha Africa. We reached out to the vice president of Nyasha Africa, Tichatarisawo, who basically tells me more about this initiative, tells me more about the organization and how the amount of money they're raising. They're looking to raise $50,000 US is going to help the Zimbabwean healthcare sector. So let's head over to an interview that I had with Tichatarisawo.
Okay, so Nyasha Africa is a non-profit organization based in DC, Washington. Started by Deborah Nyasha Peters. She approached me and she said that she's trying to see how best she can help people back home, especially in the healthcare sector. After she had issues, he had some relatives who died because of lack of healthcare. So she took that initiative to see how best she can use the resources that are out here to send some equipment and also coordinate with different medical providers. So there are different initiatives in Nyasha Africa, but the first one really is just to see how best we can send out medical equipment to help medical doctors in Zimbabwe.
Now, the healthcare sector in Zimbabwe seems to be on the spotlight right now. And one of the things that seems to be most affected by it, of course, is the whole coronavirus COVID-19 pandemic. Is there anything specific that you guys are looking to help with in terms of managing COVID-19 better?
So what we have done is we are looking at sending out equipment that includes gloves, PPE, but also to send out some other equipments because COVID-19 is the world's most talked about pandemic right now. But we do have other issues, health-related issues that are affecting the people. We've got kids that are dying because they are lack of incubators. They also lack of good sanitization. So we're trying to see how best we can incorporate everything on a health basis because just like with COVID-19, it's affecting people that have comorbidities. So if you are having issues already, pre-existing conditions, you are highly gonna be one of the people at high risk. So we want to see how best we can prevent that from happening by sending out equipment and also some health products.
Now, for you personally, you mentioned how there's, of course, Deborah Peters running the initiative. What made you want to partake in something like this?
Okay, so for me, I'm a doctor of chiropractic, so I'm in the healthcare sector, and I do have friends back home. We were planning to launch actually a program called Us and Beyond, So it's a healthcare-based program that is like integrative with medical personnel and non-medical personnel in the healthcare sector. So we're gonna do some outreaches starting in Shirugwi with my friend who's his name is Dr. Arnold Teramuka. He's based in Shirugwi. So I was talking to Nyasha about it to say, okay, this is what we're trying to do in October. But she again talked to me about her initiative to send equipment back home. So I saw it beneficial for us to work together to start the initiative here so that it can help programs like Us and Beyond back home. So that's the reason why I teamed up with Nyasha.
So this initiative, in essence, will also be helping the Us and Beyond project.
Yes, it will be helping because for the Us and Beyond project, we are going in and we're offering COVID-19 testing. We are also offering some other healthcare programs like diabetes testing, hypertension, and also giving people like consultations, even HIV testing, and some other health related conditions. So with Us and Beyond, eventually we want to open up some clinics. It could be mobile clinics and then one big clinic, but we're trying to go into remote areas to help them out. So that's where Nyasha Africa comes in, where we're trying the best that we can to work with some medical programs here that offer non-profit programs that offer like medical equipment that will help us get those equipment back home and then distribute it to different healthcare providers.
Now, outside of just sending equipment to Zimbabwe to help the healthcare sector, is there anything else that you guys are going to be doing with this initiative?
Yes, so we are planning to see how best we can work with the e-health system. So we are looking at a system in Zimbabwe. We do have electronic health records now in the world. So we're planning to see how best we can send out that information, because having an electronic health record system can help in terms of communication, in terms of like different or what can I say? In terms of different programs that are happening with different countries. So like for me, I'm a chiropractor, but for me to send information to different medical doctors back home is difficult. But if we have a database that can just send out information about like neuromuscular conditions, that will be helpful. So that's what we're trying to do. Say, put up like a communication hub for medical doctors and healthcare providers.
So is this more along the lines of just communicating, or is it along the lines of education? How would that e-health system work?
So it will have a communication and education aspect. So different, like right now in the States, they are offering like free seminars, healthcare seminars, and with continuing education. That way, different providers will be certified in different areas. But in Zimbabwe right now, the main thing is to survive, and everybody's trying to look for some food to eat, but they're not trying to look at how best they can be healthy for them to look for the food to eat.
Now, Taku, this is a youth program, so I'm more curious about the youth aspect to it. Is there anything special or anything particular to this whole initiative that could be youth driven?
Yes. So myself, I'm interested in in the young adults and the youth. So for the nation to be healthy, we need to educate our young people. We need to also give them the necessary information, especially like fitness, eating healthy. That's another thing that's lacking, where we don't talk about it that much in our communities, and we need to help those initiatives and talk about them, promote them through sport, promote them through dance, through culture. But that's the main goal, to go in and capture the young generation and get them to change their lifestyle in general.
Tichitarisa ndambotsanangura ndikati chirongwa chevanhu vechidiki. Pane zviripo here pachirongwa ichi zvakanangana nekubatsira vechidiki muZimbabwe?
Yes, tinema youth initiation programs anoda kudzidzisa vanhu vechidiki kuzvibata nekuzvichengetedza mwiri wavo, like eating healthy, vachiitika chikafu chine utano, nekuve also vano exercise vachimhanya nekuenda kugym.
Saka zvino ndiri kuona chirongwa ichi mune GoFundMe page zvichireva kuti makatarisira kushanda pamwe chete nevanhu pasi rose, vanhu vakasiyana siyana. Mungachiudzawo zvizere pakuti chii chakaita kuti muve nechivimbo chekuda kushanda nevamwewo vanhu pachirongwa ichi?
So GoFundMe page yakatanga noti toda kubatana neimwe organization inonzi MedShare. So MedShare inokupai my equipments anoendesa like kumba, anga mubhedha wepa hospitals, vangava machine yema blood pressure, and then vanokupai mahara, and then mozongobhadhara kushipa kumba. Saka taona zvakaringana kuti tibatane nevanhu vamwe maZimbabweans nevanhu vepasi rese kuti tingounganidza tirakidze kuti tiri musha mumwe chete, and tinoona kubatsirana nokuti charatsinwa achitswa neenda.
Saka mari yamuchange muchiunganidza inenge ndeyekubhadhara kutakura zvinhu zviri kubva kuno kuAmerica zvichienda kuZimbabwe?
Ndeyekubhadhara zvinhu zvikuenda kuZimbabwe nekubhadhara duty, but hatisi kubhadhara kuita sei kutenga zvinhu zvacho, chingobhadhara kuendesa kumba. Vanotipa zvese, tinotsvaga madhokotera nemalist ezvinhu zvavari kuda, and then toenda ikoko tichatora even vanhu vekuno kumavolunteers, toenda tonoita packaging kuma-offices avo kuAtlanta.
All right, Muri Zimbabwe, you just heard there from Takuratela of Nyasha Africa, an organization based here in Washington, D.C. Varikuedza kakuunganidza $50,000 to make sure kuti mari ichashandiswa mukusimudzira utano, nyaya dzeutano muZimbabwe, so the healthcare sector in Zimbabwe. Uhlelo The Connection muineni Michael Muri yeZimbabwe, tine urombo musikwanise kupinda muchirongwa semazuva ose, zvisinei tiri pano tiri chose. You can send us a text pa WhatsApp pa number dzinoti +1 202 465 0318.
Bageti salibonani. Angiyazi ukuthi kuthiwa into they are being relaxed kancane kancane ngathi kuyinto lokhu kuyadeja. Kodwa ke hayi mina ngisukuyazi ngimangale mangena la koBulawayo. Hayi lokho kuyinto kuyanehlula abantu uthola umuntu efaka okuyimazi kuvalisa ilembu. Abanye uvala umlomo kuphela amakhala phandle athi awumakanika bona kwezi omakanika hayi vele bazihlupha. Uyabona ukuthi lokho kunto kuyabahlupha, uthola umuntu esekufakela esibhaqeni ebhizi ekanika eluma ulimi, phela omakanika nokulima ulimi kumbe into abayithatha ngaphi. Kodwa bakithi ngiyacela, let's try and do the right thing. Kuthi uhamba lokho kuyinto kuhambe kodwa kungahambi nathi, sihlale sivalile amakhala lawo nomlomo kuyimask kuthe mba, sigeze izandla sisanitize always. Yikho esikupreachayo ukuthi ma ukhwehlela kwathiwa kimi umuntu akhwehlele lapha ukuthi lolu bhubhane lungabhebhetheki, mhlawumbe luyabe lukhona bakwazi ukuthi sisindise abanye abaduzane nathi. Let's always listen to the rules, mask mba, sanitize, senze izinto kahle. Ciao bangani bami. Thank you.
Shout out to Madlela Kobo, prominent comedian in Zimbabwe. The footage you just listened to is courtesy of our site, broadcasting outlet in Bulawayo. Shout out to them for letting us use their footage. Now, earlier on, I touched on the fact that we also look to focus on what's happening in the schools. One of the discussions recently prominent in Zimbabwe since the fact that Zimbabwean schools closed early throughout the year, one thing they touched on is the fact that a lot of students have now had to shift their studies online, not just high school students, not just preschool students, but including university students. So we reached out to an education expert who touches on several facets that is regarding Zimbabwe, the current state of Zimbabwean education. He focuses on how COVID-19 has affected Zimbabwean education. Here we touch on several different things, including e-learning, the current state of the education system, and what's happening with teachers. Let's head over to our expert to hear his thoughts on it.
Well, the COVID lockdown has really shaken us to the core. I think a lot of things that we took for granted have turned out to be not as clear as we thought they were. But maybe before we got there, it's important to have a small reflection on the journey we have walked over the past couple of years. Mm-hmm. If you look on a high level, just look at the ordinary level exams, you find that since 1984, between 70 and 80% of our young boys and girls in the public schools fail to get 5 ordinary levels and more. Mm-hmm. And over time, we have always noticed that there's a profound gap between the knowledge and skills that our students learn in the public schools, and for that matter, the knowledge and skills that they are required to have in the 21st century communities and workplaces. Mm-hmm. When you look at this, we have roughly 200 to 250,000 16-year-olds plus minus that fail to get 5 ordinary levels every year, coming to about 1 million. And when you look at it since 1984, that's quite a huge number of our youngsters. Mm-hmm. During COVID lockdown, it has allowed a lot of education entrepreneurs to reflect and look at these numbers and start to ask ourselves, why do we actually have our people going to school if 80% fail? Mm-hmm. What do we teach them? Those that pass whatever our exams become maybe come up with skills and knowledge that's irrelevant to the life and community that they find themselves facing. And for that matter, how do they learn and where does the learning take place? But let's come back to the e-learning issue that you talk about. Mm-hmm. Ministries of education generally have a mandate that seeks to provide equitable access to quality education to all its citizens. And for you to be able to provide equitable access, you then need to have certain infrastructure available to the majority of your people. Mm-hmm. When you look at the e-learning requires certain infrastructure to be in place to connectivity. And the last survey we did in Zimbabwe, that was about in 2018, revealed that out of the 9,500 schools with an enrollment of 4.5 million learners, you could find that about 1,000 of these schools were on ADSL. You remember the copper, our old copper, which still one is rolling out or rolled out. We had a number of about 1,000 of those schools. Then about 500 old schools on fiber, and another plus minus 750 schools on VSAT. Another 500 schools between LTE and some radio links. So all in all, you're looking at 2,750 schools with some form of connectivity, which is under 30%. And therefore, you can't even begin to talk of equitable access to quality education being anchored on e-learning when no more than 30% of your schools as your, should I say, point of reference or presence in communities is sitting at that such a low rate. And this is just at a school level. We haven't even gone at household level.
Right.
I can only tell you that it gets worse when you start looking at the numbers. We are sitting at about 4 million households, and a small fraction of them have broadband connectivity. Mm-hmm. Yes, a large part of our country is covered by a mobile telephone, but that's really on voice. Mm-hmm. The moment you drive 40, 50 kilometers out of a major settlement, you start struggling to get any form of internet connectivity on these mobile telecoms. In any case, many of the people cannot even afford. So access is first physical access to the platform, but also secondly, economic access. So even if you have the connectivity and cannot afford, you are no worse off than the person who actually does not have, because both of you can access the service that's actually consumed using that platform.
I was looking at some of the figures not so long ago, a couple of weeks back, that were released by Portras, where they were talking about the mobile subscriptions in the country. And they're reporting that this stuff has actually increased. But what does it mean? Because they're talking about the social sites like WhatsApp and so forth, saying that more people are using this. But how does this translate anything in terms of e-learning?
I think we need to understand that e-learning is not pushing information. Learning is not pushing information. It's a highly interactive, engaging process that makes use of highly complicated technologies that operate behind the scenes. Now, I'm not about to understand where the basis of what Portras is talking about, but I can tell you right now, working with the learners at home and 20 years working in schools, the majority of these people cannot afford, and a lot of them actually are in areas where there isn't any reliable connectivity to the internet. Yes, they may have access to voice telephony, but certainly the closest they have is probably some 3G, let alone 4G. You only find 4G in selected areas, Harare, Bulwe, Victoria Falls. Yet the majority of our people are actually outside these areas. The statistics are there, the numbers are stubborn. Out of the 9,500 schools, Harare has no more than 650 schools. Bulwe has no more than 300 schools. And when you take Manicaland, for instance, with about 1,400 schools, the majority of the schools are further away from the district centers like Mutare districts, Rusape, Chipinge, Chimanimani. They are back in the rural areas.
Sithanda ukubonga umnumzana Itai Masimirembwa nekupinda Muchirongwa mazvinzwira ka muri yeZimbabwe. From Itai Masimirembwa, he is a education entrepreneur or an education expert. Vanga chinyatsozeya ka nyaya ye-e-learning vachita nemaondo avo sezvo zvinhu zvakawanda muZimbabwe zvichitedza mari yakawanda, especially patobata nyaya yedata uyezve vazeya nyaya yeinfrastructure, hanzi e-learning inenge iri kutinetsei. For the full interview, please go to our website, www.voazimbabwe.com. Masimirembwa gives a full in-depth explanation as to what needs to be done to ensure that next time there's a global pandemic, Zimbabwe is more prepared and the education sector works out better. But earlier on, I also touched on the fact that munyika, which is also being accredited to the COVID-19 lockdown, and of course, nyaya kwevarairidzi muzvikoro. Recently, a lot of organizations, teachers' organizations included, have revealed that there's been an increase in terms of amount of teenage pregnancies in the country. One of them being the COVID-19 lockdown, and of course the fact that teachers are not in school. A lot of students are getting up to no good. Let's head over to a member of PTUZ, Takavakira Joe, who explains to us via telephone what exactly is happening in muzvikoro, why there's been a spike in terms of teenage pregnancies.
Takaita ongororo muma 4 provinces and chatakawana kuma 4 provinces yawo ndechokuti ma pregnancies anorenja from 1,500 to 2,500. Saka on average takaona kuti zvinoreva kuti vana 2,000 per province vane pamuviri. Saka tichitarisa izvozvo tikazotora kuti tine 10 provinces taakuchiaplya tashandisa maprovince atakashandisa for zvinoreva kuti tine vana vanopfuura 20,000 vakaita pamuviri panguva yakubva pakavharwa zvikoro kusvika pari zvino. Chikurukuru chandingada kuti nditaure ndechekuti zvikoro zvakavharwa muna Machi pasina urongwa hwakajeka hwokuti tidzidzise makommunity nevana vechikoro kuti vaonewo kuti kudzidza kune chiedza mune ramangwana. Saka vakawanda vanga vasina any form of entertainment, pasina yatingati pedagogical kana contact nevana, vakazofara havo nezvikomba vakaita pambiri. Zvekare vana vari kuona vamwe vari kumberi kwavo vachiratidza kuti havana zvavanoita, saka vanongoona sekuti chikoro hachina basa. Asi zvikurukuru zvatinoona sekuti ndo zvakapa kuti vakawanda vaite pambiri kubudikidza netsvakurudzo dzedu ndezvekuti vana vakanzwa kutaurwa nehurumende kuti iko zvino chero ukaita pambiri unokwanisa kuti urambe uri kuchikoro uchidzidza zvako. Kuvana havana vakawanda havana kuzoona sekuti kuzvidzivirira chinhu chikuru, vakaona sekuti hapana zvinovakonesa kuti vaende mberi kunyange zvavo vakaita pambiri.
All right, Muria Zimbabwe, you just heard from Takavafira Joe, Vesangano, Progressive Teachers Union of Zimbabwe. He was basically explaining his thoughts and his take on why there's been an increase in teenage pregnancies. One thing he focuses on is the fact that when schools closed back in March, he said that there was no actual there was no actual program set in line, which was going to help a lot of these young teenagers in terms of ensuring that they kept busy. And because of that, they ended up in situations whereby they're with their sugar daddies and so forth. Kunyanya panyaya dzenhumbu hanzi vana vachiri vadiki ava uye zvinotivhiringidza mafamily set up edu. Aiwa tinotenda baba Ru nemaondro enyu. Musakangano muri yeZimbabwe +12024650318 is the number you can text us by WhatsApp kana muchida kutipa maondro enyu. But now, women's rights organizations also stepped in on the conversation. Over time, we've had conversations surrounded around gender-based violence. And throughout these conversations, one thing they've also revealed and highlighted is the fact that there has been an increase in teenage pregnancies, and this is based on because of gender-based violence, and of course a lack of access to contraceptives. That's another thing that we focused on last week, where we had our medical expert Constancia Mawoza, and she was highlighting that. Let's head over to a conversation, to a clip that I have, which was sent to us by Beatrice Savage of Roots, whereby she focuses on that and reveals what exactly is happening and why there's been an increase and how the COVID lockdown has contributed to the increase in teenage pregnancies.
We're talking about the impact of COVID-19. We have seen a lot of women and adolescents, I would say, failing to access essential sexual and reproductive health services, gender-based violence services. As you know, there's a period where there was not enough PPE in institutions like clinics and hospitals. And our organization actually works in hard-to-reach areas like farming and mining communities. So you would have, service providers turning away young people. If you don't have anything life-threatening, if you're not dying, if you're not bleeding, nobody's going to attend to you. So if you want a condom, you were not able to get it at an institution, or if you wanted, maybe counseling services or HIV critical services like HIV testing, you would not get that. You'd be turned away. So it really impacted. We have witnessed and recorded increased cases of teenage pregnancies, increased cases of sexual and gender-based violence that have been reported. So that has been the impact of COVID-19. But we've also gone a step further to sort of respond to such issues. Like you asked earlier, what have we been doing besides other services that I talked about? As an organization, we have been going to communities to do what we're calling mobile clinics. So we go with health personnel, we provide them with the necessary support, with necessary PPE. Then we go to communities where people are and where people need the services. Since they can't get the services from the clinics, then we're taking the services to the people. And we found that to be very helpful, not only for adolescents or the youth, but also for women and the under fives, because we providing comprehensive services where, if a mother or a young woman comes with a child, they also get services, family planning services.
Sithanda ukubonga uBeatrice Savage ke ngokungena kuhlelo ngokusipha umbono wakhe ngalokho okwenzakalayo ezikolo lapho siyezwa abantu besithi the youth, there's been an increased amount of teenage pregnancies. Earlier on, we heard from Mr. Takavafira Joe explaining, saying this could be, the closing of schools added to that, and Beatrice Savage also explained that the COVID lockdown added to that. Bona lokwalamhla muri eZimbabwe mthwakazo omuhle sesifikile emaphethelweni wohlelo lwethu labasakhulayo tasifika kumagume echirongwa chedu chanhasi, and ndinoda kutenda all the people who added to this conversation. Msakangano kana mchitauchi pamaondering munokwanisa kutitumira mamessage edu pa WhatsApp pa number 0 +1 202 465 0318. Sesifikile emaphethelweni wohlelo lwethu labatsha muri eZimbabwe. If you're looking to chat with me at Big Mike 3 BIGMYKE3 and on Twitter and Instagram. So hlangana same time, same place, lapha kuhlelo lwethu labasakhulayo sangana pano panefenyero studio same time, same place next week. Anokoneka nemfaro ndine wenyu Mike Hove muri eZimbabwe. Mthwakazo omuhle. Bye bye.